In this time of crisis, businesses are increasingly turning to technology to safely function in the face of COVID-19. But while many of us are working at home, could another group of workers soon be heading to the office? Of all of the advantages that robots might have over humans, one could become increasingly valuable in this new pandemic world we're living in. They don't get sick. And that could be putting them on the radar for many COVID-sensitive industries.
Automation is enabled by technology, but driven by economics.
Stanford consulting professor Paul Saffo has tracked the sometimes disruptive effect of automation on the American workforce. He says the pace has been slowed somewhat by the limitations of robots, which often work best by supporting human workers rather than replacing them entirely.
Freeing up the humans to do the things the robots can't do, but the robots working in service of making the space safer for the humans.
But could new concerns about COVID accelerate that trend? Major meat processors are reportedly ramping up investment in robotic butchering after COVID outbreaks at packing plants, while service-heavy businesses, from restaurants to retail, may see automation as a way to limit face-to-face contact, letting robots stock the shelves, park the cars, and deliver the packages.
And I think that's something that we still have to proceed with caution.
Suzanne Turan is the Associate Director of the Labor Occupational Health Program at UC Berkeley. She's concerned about the costs of rushing to a robotic solution.
It can seem like it's an easy fix, having, automated check-in or having very little contact with other people as you enter a hotel or as you check into an airline. But really, we also have to think about what are we losing?
Not just the loss of human contact in a society that's evolved from it, but also potentially the loss of human jobs. Even before the COVID crisis, some experts had predicted that nearly half of our current jobs could be at risk from automation in the decades ahead. But if this is a tipping point, could it also be the moment for a national conversation about our post-COVID future?
What role do we want technology to play? Instead of technology always being seen as replacing workers or taking some of the human element out of a process, how can it help enhance something?
And already there are examples, like this germ-killing robot used at Stanford Hospital, now being deployed to secure hotels and police stations with a human handler, perhaps providing a preview of technology aiding humans in one crisis without contributing to another. Experts also point to technologies we might not think of really as robots being in much higher demand, including medical-grade air purifiers that could become common in places like dentist offices and outpatient clinics. All right, Alma, so far at least, I know they're working on it, but so far they don't have robots anchoring the news or the weather.